In a world where medical advancements are constantly evolving, one drug has emerged as a true game-changer, Aflibercept. This powerful medication has been proven to provide significant benefits for those suffering from various conditions, including macular degeneration, diabetic retinopathy, and certain types of cancer. Aflibercept works by blocking the growth of abnormal blood vessels, thereby reducing inflammation and improving overall health outcomes. But what sets Aflibercept apart from other treatments on the market? Its unique mechanism of action allows for targeted and precise treatment, minimizing potential side effects. Moreover, the hidden benefits of Aflibercept have caught the attention of researchers, who are uncovering its potential in treating other diseases beyond its initial scope. In this video, we will explore the untapped potential of Aflibercept and delve into the latest studies that shed light on its hidden benefits. Whether you are a patient looking for alternative treatment options or a healthcare professional seeking to expand your knowledge, this video will provide valuable insights into the transformative power of Aflibercept in modern medicine. Understanding the mechanism of action. Aflibercept belongs to a class of medications known as anti-VEGF drugs, which stands for anti-vascular endothelial growth factor. VEGF is a protein that plays a crucial role in promoting the growth of new blood vessels. While this process is essential for normal development and wound healing, it can become problematic when blood vessels grow abnormally in conditions like macular degeneration and cancer. Aflibercept works by binding to VEGF and blocking its action. By doing so, it prevents the growth of abnormal blood vessels, reducing inflammation and improving overall health outcomes. Unlike other anti-VEGF drugs, Aflibercept has a higher binding affinity for VEGF, allowing for more effective treatment with potentially fewer injections required. Moreover, Aflibercept's unique molecular structure allows it to bind not only to VEGF but also to another protein called placental growth factor, PlGF. This additional binding ability further enhances its therapeutic potential, as PlGF is involved in various disease processes, including angiogenesis and inflammation. Aflibercept's efficacy in treating eye conditions. One of the most well-known applications of Aflibercept is in the treatment of eye conditions, particularly age-related macular degeneration, AMD, and diabetic retinopathy. AMD is a leading cause of vision loss in individuals over the age of 50, while diabetic retinopathy is a complication of diabetes that affects the blood vessels in the retina. Clinical trials have consistently demonstrated the efficacy of Aflibercept in improving visual acuity and preventing disease progression in patients with AMD. In fact, studies have shown that Aflibercept is superior to other anti-VEGF drugs in terms of visual gains and the need for fewer injections. Similarly, in diabetic retinopathy, Aflibercept has shown promising results. The drug not only reduces macular edema but also improves vision and slows down the progression of the disease. This has significant implications for diabetic patients, as diabetic retinopathy is a leading cause of blindness worldwide. With its targeted mechanism of action and proven efficacy, Aflibercept has revolutionized the treatment of eye conditions, offering hope for improved outcomes and quality of life for patients. Aflibercept's impact on cancer treatment. Beyond its role in ophthalmology, Aflibercept has shown promise in the field of oncology. Cancerous tumors require a blood supply to grow and spread, a process known as angiogenesis. By blocking the growth of new blood vessels, Aflibercept can effectively starve tumors and inhibit their progression. Clinical trials have explored the use of Aflibercept in various types of cancer, including colorectal cancer, lung cancer, and ovarian cancer. In combination with chemotherapy, Aflibercept has demonstrated improved overall survival rates and prolonged disease-free intervals. In colorectal cancer, Aflibercept has been approved for use in patients who have already received chemotherapy. It works by targeting the VEGF-A protein, which is overexpressed in these tumors, leading to improved outcomes and a delay in disease progression. Similarly, in lung cancer, Aflibercept has shown promise in combination with chemotherapy. It has been found to improve overall survival rates and delay disease progression in patients with advanced non-small cell lung cancer. In ovarian cancer, Aflibercept has been studied in combination with chemotherapy and has shown promising results in terms of improved progression-free survival. This offers new hope for patients with this aggressive and often difficult-to-treat cancer. The potential of Aflibercept in cancer treatment is still being explored, and ongoing research continues to shed light on its role in improving outcomes and expanding treatment options for cancer patients. Aflibercept's role in cardiovascular diseases. While Aflibercept's primary use lies in ophthalmology and oncology, recent research suggests that it may have potential applications in the field of cardiovascular diseases as well. Cardiovascular diseases, including conditions like atherosclerosis and peripheral artery disease, are characterized by the formation of abnormal blood vessels and impaired blood flow. Preclinical studies have shown that aflibercept can effectively inhibit angiogenesis in animal models of atherosclerosis. By blocking the growth of new blood vessels, it can potentially reduce plaque formation and prevent the progression of atherosclerotic lesions. Additionally, aflibercept has been investigated for its potential role in treating conditions like diabetic nephropathy, a complication of diabetes that affects the kidneys. By targeting the underlying angiogenesis and inflammation processes, aflibercept may help slow down the progression of diabetic nephropathy and reduce the risk of kidney failure. While further research is needed to fully understand the potential of aflibercept in cardiovascular diseases, these preliminary findings open up exciting possibilities for the future of treatment in this field. Aflibercept's role in managing diabetic complications. In addition to its impact on diabetic retinopathy and nephropathy, aflibercept may also hold promise in managing other diabetic complications. Diabetes can cause damage to blood vessels throughout the body, leading to conditions like diabetic foot ulcers and diabetic macular edema. Research has shown that aflibercept can effectively reduce the size of diabetic foot ulcers and promote healing. By inhibiting angiogenesis and reducing inflammation, it helps improve blood flow and accelerates the healing process. This has significant implications for patients with diabetic foot ulcers, as it can prevent complications such as infections and amputations. Furthermore, aflibercept has been found to be effective in treating diabetic macular edema, a condition characterized by fluid accumulation in the macula. By reducing inflammation and fluid leakage, aflibercept improves visual acuity and reduces the risk of vision loss in diabetic patients. These findings highlight the potential of aflibercept in managing various diabetic complications, offering new avenues for treatment and improved outcomes for patients living with diabetes. Aflibercept versus other treatment options. When considering treatment options, it is important to compare the benefits and drawbacks of different medications. Aflibercept's unique mechanism of action and binding properties set it apart from other anti-VEGF drugs like ranibizumab and bevacizumab. While all three drugs target VEGF, aflibercept has a higher binding affinity, allowing for more effective treatment. This means that patients may require fewer injections, reducing the burden of treatment and potentially improving compliance. Moreover, aflibercept's additional binding ability to PlGF may confer additional benefits in certain disease processes. PlGF is involved in angiogenesis and inflammation, making aflibercept a potentially more comprehensive treatment option. However, it is important to note that individual patient factors and preferences should also be taken into consideration when selecting a treatment option. Factors such as cost, availability, and specific disease characteristics may influence the choice between aflibercept and other medications. Consulting with a healthcare professional is crucial in making an informed decision. Common side effects and safety considerations. Like any medication, aflibercept does come with potential side effects and safety considerations. The most common side effects include eye pain, increased intraocular pressure, and floaters. These side effects are generally temporary and can be managed with proper monitoring and follow-up care. Additionally, there is a small risk of serious complications such as infection or retinal detachment. However, these risks are rare and can be minimized with proper patient selection, monitoring, and adherence to treatment protocols. It is important for patients to discuss any concerns or potential side effects with their healthcare provider, as they can provide personalized guidance and address any specific considerations. Future prospects and ongoing research. The potential of aflibercept in modern medicine is still being explored, with ongoing research shedding light on its hidden benefits and expanded applications. Researchers are investigating its role in various diseases, including neurological conditions like Alzheimer's disease and multiple sclerosis. In Alzheimer's disease, studies have shown that aflibercept can reduce neuroinflammation and amyloid beta deposition, two hallmark features of the disease. This offers new hope for potential therapeutic interventions to slow down or halt disease progression. Similarly, in multiple sclerosis, aflibercept has shown promise in animal models by reducing inflammation and protecting against nerve damage. Further research is needed to determine its efficacy in humans, but the preliminary findings are encouraging. These ongoing studies highlight the potential of aflibercept beyond its current applications, paving the way for new treatment options and improved outcomes in various disease areas. Conclusion: aflibercept's transformative impact on modern medicine. Aflibercept has emerged as a true game changer in modern medicine, offering targeted and precise treatment for various conditions. Its unique mechanism of action, high binding affinity, and additional PlGF binding ability set it apart from other treatment options, making it a powerful tool in the hands of healthcare professionals. From its proven efficacy in treating eye conditions like macular degeneration and diabetic retinopathy to its promising role in cancer treatment and potential applications in cardiovascular diseases and diabetic complications, Aflibercept has transformed the treatment landscape. As research continues to uncover its hidden benefits and expand its applications, Aflibercept holds the promise of improved outcomes, enhanced quality of life, and new hope for patients around the world. Thanks for watching.